Hi, I'm Adele. I'm a Year 2 medical student at BSMS, and I'm going to be taking you through what a week in the life looks like for me at BSMS. So, this week is actually a bit of a different week because it is the last week of term before Christmas holidays, so we have an immersion week. And I thought it would be really interesting to show you what it looks like because before I came to year 2, I had no idea what an immersion week was like. And I have GP teaching. So basically, you get 4 immersion weeks throughout year 2, and it can either be a community hospital placement, it can be a GP placement. There's also online teaching, one where you do basic life support as well, actually. And this week, I have GP teaching on Pharma Campus in person. But yeah, I've basically come to the end of module 202, which is the brain, body, and mind. So I've been basically doing neurology this whole term, and it's been very challenging but extremely interesting. And yeah, I think this is going to be a really fun way to end it. Because I'm filming an immersion week, I'll just quickly run through what a typical week would look like as a year 2. So on Monday, we usually have dissection. So we go into the dissection lab and get to look at different prosections, normally on different lectures that we've recently done. So it's really good to supplement your knowledge with these sessions. Sometimes on Mondays we do have imaging as well. So last week we had an ultrasound on the brain, the spinal cord, and the head and neck. And Tuesdays we normally have student selected components in the morning. So it's just sort of like a little mini module that you choose yourself, sort of in any area to do with healthcare and medicine. So this term I have done art psychotherapy, which has been super interesting. And then we normally just have lots of lectures in the afternoon on Tuesday. But this makes up for it because on Wednesday we have lectures in the morning, but we have the afternoons off, which is really nice to have that time to do anything you want outside of medicines, any societies you enjoy. So on Thursdays we have more clinical days. So in the morning we have a seminar, and then in the afternoon we can have any sort of clinical skills. So last week I went to the hospital and was on ICU, for example. On Fridays we normally have lectures or symposia where patients will come in and speak about their conditions. But yeah, I'm really excited to show you my week now. Today is Monday morning and I have a lecture and then a seminar in the morning, and then in the afternoon I'm pretty sure I'm taking histories from simulated patients. So in the morning I had a lecture and a seminar on clinical reasoning, and in the afternoon me and my placement partner we took a history from a patient actor, which I'll talk about more in a second. And after this I went to meet my friend at Farmer Bar to get some food. Just to quickly go over what I meant by when we took history from a patient actor. So basically different patient actors came in for the last session that we had this afternoon, and in our pairs, so with our placement partners, we took a history, and basically on Thursday we have to present a CBD, so a case-based discussion outlining what our differential diagnosis is. So yeah, why we excluded other conditions and why we think based on our history and examinations, and basically we just come up with a whole management plan of investigations and treatment that we do if they have the condition that we think it is, and yeah, why we would exclude other conditions and things like that, which is really good practice because at the end of the year we do have a summative OSCEs where patient actors will come in and you'll either have to examine them or take history from them and potentially figure out a differential diagnosis as well. So it is good preparation for that. Last year in year 1 we had formative ones, so I feel like it's really good. BSMS really builds up, the level and the standard every year, and you can see it and you can feel it, but also, yeah, you get a lot of support and practice, which is good. And I finished my evening by doing some work and attending a NeuroSoc meeting about a conference that we have next year, as I'm the year 2 rep. Hey, so today was Tuesday and today was a very long day. I started with a seminar in the morning. It was 2 hours, again on clinical reasoning. So in this seminar we went through more patient cases and figured out our top differential diagnoses for each case, and we really went through the clinical reasoning of why we would have these as our top ones and exclude others. So in my lunch break I worked on my reflective piece, which I would have a meeting for on Thursday, and then me and my placement partner, we started to work on our CBD, create our presentation and discuss the history we took the day before. In the afternoon from 3 to 5, I had something that's called a virtual clinical experience. So we basically sit in a group of medical students, you have a facilitator in the room, but you are watching a GP consultation live. So it's really good because after they've done the consultation, or even throughout the consultation, you can ask the GP questions and ask the patient questions, and then you can discuss in your group and with the facilitator any questions that you want. And yeah, I think BSMS are really ahead of their time. I don't think a lot of medical schools do this, and I mean it's really convenient because you just do it at the Watson building, so yeah, on campus, instead of actually like going to the GP, which takes time and money. So yeah, it was a really good experience. So after the virtual clinical experience, I headed over to Sussex campus just to study in the library for a little bit before my TAP class. So just touched up on the CPD presentation a bit and did some Anki. After dance, I'm always starving, so I made dinner. So tomorrow I'm doing communication skills in psychiatry in the morning, and I think it'll be really useful because we've had lectures and symposia on different psychiatry like conditions that can come up, but we haven't really like practiced taking history for like mental health and different conditions in psychiatry. So yeah, I'm quite excited to do that. In the afternoon, I'm not sure what it is, but I think it's a simulated physiology session. I'm not sure what it is, but I will get back to you on that tomorrow. And in between these GP teaching sessions, I have dance. So for an hour, I will be teaching some choreography to some jazz dancers that I've made over the past few days, and I'm really excited. It's an Amy Winehouse song, and I love a bit of Amy Winehouse, and I love to choreograph and teach dancers, so I'll show you a bit of that. And then I have contemporary rehearsal from 1 to 2:30, I believe, so yeah, I'll just bring you along. So this is me on Wednesday morning and my psychiatry history taking session. Just had my psychiatry communication skills session, and it was really useful because we were taking histories from like three patients, like each in different groups, and yeah, just coming across like different scenarios really. Like one was talking about like loss of parent, one was like seeing different things, and yeah, it was just different scenarios and how you'd approach them and show empathy and be patient with them. So yeah, I think it was a really good experience because I've never really done a psychiatry history before, but yeah, now I'm heading to teach my jazz class and then I'll have contemporary after.
You don't own nothing to me but to walk away. I have no capacity. He walks away, the sun goes down, he takes the day, but I'm grown and in your way.
Yeah, that. Oh, that's sick. So the physiology that I was on yesterday, that turned out to be an A to E session, which was really useful to go over because we did go over it in year one, but not in this much detail. And yeah, it's really important, I think, to keep going over it because I mean it is basic skills of a doctor, and it will come up in OSCEs. So yeah, we just went through 2 different patient cases, doing airway to exposure and the different sections in it and how it applies to this specific patient. Yeah, and we just went through the different equations and different relevant types of shock, and it was really good because I feel like I forget things so easily, so it was a good refresher, I'd say. Hey, so now we are on our way to Sainsbury's because we need to buy some supplies for our ski trip that we're leaving for on Friday. Yeah, it will be. It's for my week in the life. We can put on Quacky and on both. Vlogging. Wow. Hey, so today is Thursday, and this morning I had a meeting with my clinical facilitator just to talk about a reflective piece that I wrote, and we sort of just discussed how I'm finding this term and the course so far. And yeah, this afternoon I have my CPD presentation, so I'm just quickly reading over the slides and preparing anything, making some last minute changes. But yeah, I'll let you know how that goes. So here I'm just making my way to Farmer Campus, and my CPD presentation actually went pretty well and I got very useful feedback on it. And I had some time after because we finished early, so I did some work and then I headed to the gym for a while. I'm on the way to Shuffle Bar, which is my favourite bar ever, and I'm meeting my friend there, so yeah, I'm really excited. Why did that delay so bad? So on Friday I actually had a day off, which is quite rare at BSMS, but this worked out great for me as my coach was leaving on Friday. So yeah, that was my last week before Christmas holidays, and I started it off with a ski trip with the Sussex Snow Society, and I hope that this video was useful and that you enjoyed it. And yeah, thanks so much for watching, and I thought I'd just end this video with a few ski clips because honestly this trip was so much fun.
Versatile. And now the baby. This is not. This is not real. Now the baby. Oh, there's actually no way. She's so funny. Where's Leah? Oh. You're doing good. You're literally doing good.